So let's talk about developmental care. First thing we need to talk about is a corrected age. That means if your baby was born, say at 32 weeks, when your baby's actually 2 months old, technically they're still just a newborn. So you have to remember that when it comes to developmental milestones with your baby, okay? Now some things that we can do, no matter how early your baby was born, that we can do to help development is things like singing and reading to your baby. They love soft music. They are startled by really loud sounds. Using kangaroo care, skin to skin, is excellent for your baby. It's very good for your baby's brain development. We also have extra handouts on the kangaroo care. If you would like those, just ask your nurse for one. Some things that we want you to do is to limit the use of certain things. We're not saying never to use them, but don't overuse them. Things like that are your swings, your exercaucers, your walkers, your Johnny jump ups, your bumpos, and your boppy pillows. Those are all fine things to use, just don't overuse them. If you overuse those, it can actually cause a delay in their muscle development, and it can cause them to totally skip some of the certain milestones that they need. The other thing that they can do, and it's really good for them, is tummy time. Tummy time is extremely important. It actually helps with their neck and shoulder muscles. So we do want you to provide that 1 to 2 times a day for up to 30 minutes each time. The important thing about tummy time is that they actually have to be awake. If they fall asleep during tummy time, pick them up, lay them on their backs in their cribs, and let them go to sleep. What we want you to do is you can use either a mat on the floor, or if they're really little and preemie, you can actually just lay back and use your chest as a tummy time tool. So with tummy time, you're going to lay them on their bellies, and chances are they're not going to like it. We do have babies that just scream and cry as soon as you put them on their bellies. So while they're on their bellies, you can put out a toy that is age appropriate, let them look at it, try to reach for it, and let them, what we're looking for is to have them pick up that head and turn that head from side to side, strengthening those neck muscles and the shoulder muscles. You need to stay with your baby when they are doing tummy time, and there doesn't need to be any other children in the room during tummy time. If your baby happens to fall asleep during this time, you're just going to pick them up and take them and lay them down, because if they're asleep, then they're just sleeping on their tummies. They're not actually doing tummy time.